Good morning, all. I, Dr. Harita Desai, Assistant Professor of Pharmacy, Bombay College of Pharmacy, welcome one and all to Day 2 of the FDP program on Innovation Management for Nurturing Entrepreneurship Culture in Educational Institutes, organized by the Department of Pharmaceutics, Bombay College of Pharmacy, under the aegis of the AICT Atal FDP program. The economic growth and progress of any kind depends on the generated knowledge, applied innovations, and entrepreneurship. The need for sustained technology development has led to an enhanced emphasis on innovation in all fields. There is a need for disruptive innovation in firms and academic setups to meet the growing demands for new technologies. In the presence of spontaneous ideation arising out of academic setups and the consequent hiatus towards successful translation into commercial domain, nurturing of ideas and identification of successful strategies is required for seamless transfer of technology from academia to industry. The current FDP program is focused on addressing all the aforementioned points. With this brief note, I now welcome upon the chairperson for the session 4 of Day 2, Dr. Elvis Martis, Assistant Professor of Pharmaceutical Chemistry, Bombay College of Pharmacy, to welcome our speaker for session 4, Mr. Gavin D'Souza. Our session 4 is titled as Market Research, a Methodology for Constructive Ideation. I welcome Dr. Elvis Martis.
So, good morning, everyone. It gives me a great pleasure to introduce our speaker for today, Gavin D'Souza, who's going to talk to us about market research, a methodology for creative ideation. Gavin earned his bachelor's degree, Bachelor of Pharmacy, along with MBA in Pharmaceutical Management and Marketing from the School of Pharmacy and Technical Management, NMIMS, Mumbai. After that, he pursued his postgraduate diploma in regulatory affairs from Institute of Pharmaceutical Management, Mumbai. Then he joined Glenmark. At Glenmark, Gavin handled launching and marketing of first time in India innovator molecules, specifically for oral anti-diabetic sector since 2019. He's now the group product manager at Dr. Reddy's. Gavin brings with him immense experience of 5+ years in pharmaceutical industry, handling diverse roles such as brand management to Salesforce excellence. Gavin is recipient of the Chairman's Excellence Award at Glenmark under the Best Team category. He's also the recipient of the Annual Brand Plan Award at the annual conventions and also the SPOT Awards for exceptional work nominated by the marketing and divisional heads. With this, Gavin, I welcome you to this, and the crowd is all yours.
Thank you so much, Dr. Elvis, and good morning to one and all. On behalf, I would like to thank the entire managing committee for giving me this opportunity to share my views on a topic which is currently, the talk of the town. And I hope we would have a very interactive session. And that's how I've kept it. So please allow me to share my screen and someone would just confirm is visible. So a very good morning once more. And as mentioned already, my topic today would be market research, methodology for constructive ideation. This topic varies from end to end. It has a lot of applications. But what I've tried to do today is to maintain a constructive ideation for the presentation itself, as well as also bring about some kind of examples which are relevant and we can associate to a particular principle of market research. So with this, this is basically my presenter disclosure that currently is a part of Dr. Reddy's laboratory. And the content is basically based on everything available in public domain and on my years of experience. No disclosure of any confidential information from the current or previous organization. None of these relationships affect the choice of developing content. No financial relationships are related to this presentation, completely unrelated. not speaking about any products or medications, and all the content or AV used in the form are from the public domain with no self-interest. So yes, with this, let me just start off with a quote that if you want someone to remember your message in a presentation, an article, or a report, tell them a story. So here, so I am here today to tell you all a story, and I am eagerly looking forward to your contribution as well as your interaction. As in, whenever we pause in between, as in whenever we want to have a discussion, we can, take it up with few comments whenever we are putting certain activities in between. So here I am today to tell you a story of how market research is important and how market research will definitely add a little more to our constructive ideation and particularly look at how to convert ideas into certain concepts which have a commercial value. But with this, I think the biggest idea we've seen in the Indian markets is what an idea surgery. And I hope that you all will relate to me that this had been a phenomenal time where idea had come in with a change. And what actually triggered the change is what I would like to show you all. So I would just play a video. Let's go through the video and then we talk about it further.
अरे अरे अंदर कहाँ आ गए?
बच्चे को स्कूल में पढ़ाना है।
एडमिशन फुल है।
अरे
चलिए।
भाई साहब गांव में स्कूल नहीं है तो कैसे पढ़ेगी? मेरे पोती को भर्ती कर दो। गांव में स्कूल नहीं है तो कैसे पढ़ेगी? अरे वो पढ़ेगी।
एक स्कूल में सबको कैसे पढ़ाऊं? आइडिया।
Good morning, children.
Good morning, children.
चुप। Good morning, teacher बोलो।
Good morning, teacher.
Good.
2 3s are 6. 2 3s are 6. 2 5s are 10.
E4.
Teacher, elephant. कौन कर रहे बच्चे? Copy. मुर्गा बन जाओ.
Q4. S4.
Left, right, left. Come on. Get well down and broke it down and kill him down.
And the best student of the year is Lakshmi Raghav.
Sarchi.
What an idea, Sarji.
The video was basically to highlight that how important an idea is and how important is for us to understand that every idea, if it has a scalability, if every idea has the right need to understand the particular problem, where it was clearly mentioned that education was limited in the rural markets. And one idea that came up that how one mobile phone could be connected to one particular presenter, and there is where you could connect to hundreds of students, educating them. And at the end of the day, that created an entire cause, that created an entire important purpose that was able to establish through a small idea, and as you could clearly see in the video. So, keeping this in mind and where we would start off with the presentation with ideation is the mother of all invention. So today we will be talking about what is an idea, why is there a need of divergent thinking, which is again, as the part of this entire program. Then what is the importance of divergent thinking versus convergent thinking when it comes to ideation? What is market research? More importantly, how to devise the right path for research? Maybe from looking at pure pharma research, from the from the technical as well as the managerial side, we would look at few good examples of how research created an impact. How do you constructively ideate? That is where we talk about design thinking, which is definitely something that holds true in the current scenario. that we need to be a little more specific when we ideate and have a little more construction and process and format to it. And last but not the least would be key takebacks. So yes, I start off with a simple definition of what is an idea. An idea is a thought or a suggestion as to a possible course of action. So what this actually means is that if I have an idea, it is a thought which has a direction, which is a thought which has an implication to create some kind of future value. An example of an idea, as simple as a chef coming up with a new menu item, sometimes such as a thought or a conception that is the product of mental activity. So, currently we do have a lot of ideas. I'll just move on to the other screen. And could anyone give me an example of what could be a possible idea in the pharma industry? I know it's a very, very simple question, but you can mention it in the chat box or you can unmute yourself. Any particular, what would be an example of an idea in the pharma industry? Yes, Dr. Rana, absolutely. New products, yes, disease-related, improved products. Yes, Dr. Priya, that's a really good thought that coming from the management background. Sugar testing kit, which is the glucometers, was a very good idea. Absolutely, new formulations. So yes, these are few very, very good examples in the space of pharma. Again, yes, dispenser for dose product packaging innovation. Meet the need of the hour. Absolutely right. When it comes to having an idea, when it comes, to a newer innovation itself. I'll just wait for the last few comments. Thank you so much for your comments. Really good to see interacting with you all. New diagnostic devices, absolutely. You have the change of devices going from a bigger size to actually coming up to handheld devices in the field of cardiology, in the field of endoscopy, as well as urology. So yes, I'll go back to my presentation. Thank you so much. So yes, these were clear ideas in pharma. And everything that you all mentioned were not just ideas that did not conceptualize into commercial value. Each of these ideas, if it's linked to a commercial value, and as rightly said in the introduction, that how technology transfers from academia to the industry is very important. Ideas are generated in academic institutes majorly because of the kind of research work that is being done, the kind of inclination towards the thought process. Major newer ideas come from academia. But what is also important is whether these ideas can be tech transferred to the industry in terms of commercial value, is what we are going to understand today in the presentation. So yes, I basically would also see in the brochure that there was this line called as ideation, a need of divergent thinking. So when I also was sitting and making the presentation, I thought about this very clearly. That what is ideation? So ideation, as we know, is the formation of idea and concepts. What do you mean by need? So need is you require something because it is essential or very important rather than just desirable. So if it was desirable, it would read as ideation, a want for divergent thinking, which I wouldn't agree to. It is an actual need because it is essential. And what do you understand by divergent thinking? The process of divergent thinking is a thought process or a method used to generate creative ideas by exploring many possible solutions. It typically occurs in a spontaneous, free-flowing, and non-linear manner, such that many ideas are generated in an emergent cognitive fashion. So yes, to be very honest, when the first time I looked at convergent and divergent thinking, this concept became a little difficult to understand at the start. But please keep in mind that divergent thinking is the one that leads to newer solutions. When you are actually ideating. So how to make this easier is what I would like to look at another video that clearly clearly defines what was a divergent thinking, what is a convergent thinking, and what are the kind of applications that we look at both in terms of divergent convergent.
Imagine you have a problem that you need to solve, and you're looking for innovative solutions. In this moment, there's a good chance you'll choose one of two cognitive approaches. In 1956, the psychologist J.P. Guilford coined the terms convergent thinking and divergent thinking to describe these two contrasting approaches. Convergent thinking is linear and systematic, while divergent thinking is more web-like, focusing on the connections between ideas. Convergent thinking narrows down multiple ideas into a single solution. On the other hand, divergent thinking expands outward by generating multiple ideas, often thinking like a hacker and using materials in original ways. Here you treat barriers as design opportunities. Convergent thinking tends to be more focused, while divergent thinking is more flexible and iterative. Convergent thinking is analytical and focused on what's best. By contrast, divergent thinking is more open-ended, and participants are encouraged here to take creative risks, even if some of the ideas might not work. Convergent thinking asks why. Divergent thinking asks why not. Now, it may seem like these two approaches are competitive, but they actually go hand in hand. Often teams will use divergent thinking to generate multiple ideas, followed by convergent thinking to analyze and narrow down the ideas, and then later you'll use divergent thinking to come up with fresh perspectives, followed by convergent thinking yet again in this ongoing cycle. Both are necessary.
Yes. So I hope the video was able to bring about a perspective of what is divergent and convergent thinking. So I just come back to the screen to have just an understanding. Could someone put up a basic idea of what could be a convergent thinking and what could be a divergent thinking? If someone could unmute themselves also would be great. What could be possible examples that we are looking at from a convergent and divergent thinking, if you've got some clarity from the video itself? Okay, I would like to respond to this. When we look at drug discovery, when we are shortlisting, yes, Dr. Rana, convergent would be a specific idea that we are talking about. Absolutely. Yes, convergent is focused. Yes. Divergent is which can appeal mass audiences. Absolutely. Divergence has a broader objective. Yes, to some extent, would agree on that part. So again, divergent has many solutions. Yes. Dr. Ria has written, divergent thinking would be involving discussion, the venue designed by an event management company, and conversion thinking would revolve around client specific requirement. Absolutely, that's a very specific and correct way of looking at it, which helps to solve a basic problem of the middle class population. Correct. That would look at more of a divergent thinking.
मतलब कि वो चीज खत्म नहीं होगी बट उसका बस ट्रीटमेंट चलता रहेगा हमेशा आपको ट्रीटमेंट देना पड़ेगा ठीक है तो इस तरीके से सो इसलिए क्रॉनिक है मेनली मेटाबॉलिक डिसऑर्डर इन व्हिच द यूज ऑफ कार्बोहाइड्रेट इज impaired and that of lipid and protein is enhanced.
Okay, which is all the basic of the middle class population. So thank you so much. I think you were able to clearly differentiate what divergent and convergent is. But one thing, if you could have seen in the video, which was absolutely very clear, is that a divergent thinker thinks all possible ways to reach a solution, whereas a convergent thinker thinks of a final solution. In this current scenario, when we look at pharma, what we've realized is that there has been a saturation in terms of what are the kind of solutions that you provide. When we clearly look at pharma, it was product oriented earlier. That, for example, that if someone is suffering from hypertension, we would always think of novel molecules or novel targets of how to get that particular given receptor and how the modulation should happen, leading to a particular pharmacological solution for it. But now the particular need of the patient becomes that managing hypertension, managing his health, preventing any kind of comorbidities. So in this aspect, conversion thinking really doesn't give us very good solutions. Conversion thinking will help us to converge on the multiple ideas that we have. So thus, why it is very important to need divergent thinking in the process of ideation is because this helps you think of possible ways to reach a solution. Second is, it also puts you in a situation where there is risk involved. But as we all know, higher the risk, higher the returns. That's how divergent thinking fits the correct puzzle piece when it comes to constructive ideation. So yes, so I hope I was able to differentiate and taking the importance of divergent thinking, which will definitely be seen, in the further part of the presentation where we have applications to divergent thinking. So yes, my presentation would be completely incomplete if I would not talk about the most recent facts that we are talking about coronavirus-related research. If you can see that experiments seeking a coronavirus vaccine are taking place, but any widely available vaccine is at least a year away. So these were the research, that was being done from, again, a divergent perspective, because coronavirus was new, the understanding was limited. So if we only thought of taking care of COVID-19, the kind of approaches that we would take is a simple solution to managing the condition. But what was more important is managing the condition, managing the population, ensuring vaccination, at the same time ensuring no kind of probable fatal cases associated with coronavirus or the vaccination drive. So if you could see here, the second point, the idea that came in. While the world awaits a vaccine, a team of 100 scientists identified 50 drugs that could possibly treat the infected coronavirus. So here you could also see that there were two solutions. One is manage the condition, the second is prevent it. So that also comes in from Divergent. As I said, we are looking at two various aspects here, thus keeping the entire idea open. So with a lot of newer molecules coming in from favipiravir, remdesivir, in terms of managing the condition for COVID-19. But what was also most important is how some drugs being researched were previously used to fight other diseases with mixed successes. Again, another divergent thought that whichever molecule existed already, can be repurposed for COVID-19. And that's what happened with most of the molecules that we were looking at. Another type of research tries to predict how coronavirus spreads under various scenarios. Another divergent point. That not only limited to patients suffering from comorbidities, we also looked at asymptomatic. We also looked at within the age groups of 18 to 40, the most susceptible population, understanding demographics, understanding epidemiology, where this again came in from a divergent thought. And last is another line of research that finds coronavirus can exist several days under surfaces, under certain circumstances. So with this, I think everyone has realized the importance of sanitation. Everyone has realized the importance of disinfection, where even companies took this as a very good opportunity of launching new product lines, where I nearly never imagined that we would come up with a vegetable wash to prevent coronavirus. So Veggie Wash was one of the brands that had come out, that where they say that you wash your vegetables with this instead of just plain water. So all these thoughts put together, if we were being a conversion thinker, we would only think of how to cure the disease. But being a divergent thinker, you also thought about how the ideal solution needs to be developed in terms of vaccination, how certain preventable where we spoke about entire vitamin C, zinc coming in, and entire newer molecules which were previously used. Also, research was tying up to the coronavirus spread under various scenarios, and at the same time, how do you prevent it from further engaging? So that's how a thought process was built, and that's how we are looking at much improved scenario today. So yes, as of now, we did understand the introduction of what is an idea, what is divergent thinking. Now, what is market research? So I'm sorry, I like to keep coming back to the screen. In a nutshell or in a very basic way, could someone tell me what do you mean by market research? As it's today's topic, so a few comments from your end also would be great. Absolutely. Problem identification. Firstly, need identification. Okay. To understand the need of the market and its demand. Yes, target audience identification is a part of rolling out market research. Knowing market requirements, identifying potential customers. Yes, gathering information. Absolutely. So I think everyone in the all my fellow attendees have actually creating demand. Correct. I've actually very well put all the steps of market research, so making my session much easier to talk about in this time. Identification needs and market opportunity. Absolutely. So yes. Thank you all for putting up clear understanding of this. Correct. I can see a last comment of information. Yes. So thank you. So what is market research? So if I go into the definition, market research is the process of determining the viability of a new service or a product through research conducted directly with potential customers. Here, market research allows a company to discover the target market, get opinions and other feedback from consumers about their interest in the product or service. So to put it as you rightly said, that what is very important is to understand the viability of the new service or product, whether this given idea can be scaled up associated to a commercial value that would definitely help understanding and satisfying the need of the customer. So why is market research so important? Conducting research is one of the best ways, as you all have already mentioned, of achieving customer satisfaction, reducing customer churn, and evaluating four important things that we get from market research. One is the valuable information, customer-centric information or customer centricity that is coming, forecasts, and very important is a competitive advantage of why your particular idea is the one that will create a difference, is the one that will satisfy the need of the customer. So yes, I think everyone is well versed with the image in front of me, and it is clearly seen as the biggest example of an organization, or I think it's more of an organism these days when it comes to Apple, because it keeps evolving so fast. It keeps coming up with new products. But what is more important is how does Apple, as a organization, are able to come up with new products that help satisfy the need of the customer. And very, very important, the biggest tool that is there is market research. And Apple is a very, very good example of a divergent thinking organization as well. And if you can clearly see that in the next slide, there is something called as a SWOT analysis. Again, SWOT analysis is a basic internal assessment of how your strategy is going in. What are your strengths? What are your weaknesses? What are your opportunities? And what are your threats? And clearly, you can see that your strengths and weaknesses hold in internal to yourself as well as an external is opportunity. So I'll just read through and explain how Apple focuses on market research, their overall SWOT, and how important it is for them to make this model to start to understand the need of the market. So the strengths are: it's a global icon, it has top technology, it's the brand of choice, it has proficient research, sustainability made possible through lab. So these are certain strengths of Apple. When we look at weaknesses, lack of marketing and promotion. When you look at Apple, Apple has very limited marketing and promotion as compared to other technology brands. Second is lack of competition, which is very, very clear in the space of Apple, that why is competition lacking here is because the kind of differentiation that is brought in the products. Products are highly priced, which are not sometimes viable to all given masses in population, and that's a choice of Apple. and incompatibility with other software to maintain relative exchange of platforms. When we look at opportunities, which becomes very, very important from market research point of view, how do we know that there is consistent customer growth? So you can clearly see that technology has been adopted much earlier in a population which is from the age of 18 up to the age of 45 on an average, where the adoption rate is very high. So Apple targets these kind of customers. How did they know it? By doing market research to understand what are the changing trends. You look at qualified professionals who are using these technologies. Expensive distribution network, expansion of distribution network. The opportunity is the lack of green technology, which is something that is coming up these days. Smart wearable technology, from the Apple watches to as simple as wearable that is actually emerging from a trend perspective, and utilization of artificial intelligence. Also, what is important is to understand the threats. Yes, if you can see that in terms of threats, it's bullied by counterfeits. There's increasing competition. Market penetration becomes a threat with other companies, and various lawsuits associated with Apple. So yes, if we look at this model, this clearly tells us where Apple is strong, where Apple needs to be, what Apple needs to take care of, and how Apple should counter. So SWOT analysis ideally becomes very, very important once your research has been completed. With this, let's understand quickly in terms of what is the primary research and what is the types of research that are available. So here you can see primary research, which is a combination of qualitative and quantitative research. Primary research is a process where organizations and businesses get in touch with the relevant customers and employ a third party to carry out some relevant kind of study or collection of data. This can be done in a non-numerical as well as a statistical data. While conducting primary research, one can gather two types of information. One is exploratory and one is specific information. When we look at secondary research uses information that is organized by outside sources. So already available sources where we can clearly see that information that is published in newspaper, magazines, books, company websites, free government and non-government agencies, where the sources would be public sources, commercial sources, education sources. Now, if I clearly talk about today's presentation becomes a secondary research. Why? Because it is an idea collated from the available public domain with a few experiences of myself that I would be talking about as an example. But when we talk about primary research, what it becomes important is in terms of novelty, that if there is a new kind of thought that is coming in, thus that's when we bring in primary research. So yes, I come back to to y'all. From a commercial standpoint, if I talk about primary research, again, taking an example of diabetes, would be to identify the needs of patients who have microvascular complications along with diabetes. So this is something which would be new. Would be looking at newer kind of therapies to come in for a novel solution. A secondary research would be what is the increasing prevalence of diabetes and how is epidemiology managing it. So this is from a more commercial standpoint. From a pharma technical research, I would like your responses. That what would be an example of a primary and what would be an example of a secondary research. So primary research again indicated to bringing up or identifying the need of something that has not been done before. Secondary research is a basic collation of whatever is there. Yes. Yes, Dr. Rana. We have primary research which talks about rough ideation. Okay. Yes. So my question is that what could be possible examples of primary research and secondary research from a pharma technical background? So the ones that I gave was from a more commercial, from a more marketing background. From a technical background, what would be examples of primary and secondary research? So yes, Dr. Priya says that primary research to find out via survey why people are hesitating to go for vaccination. Absolutely, absolutely right. Yes, Dr. Suresh. We have drug discovery is primary research, market survey secondary research. Absolutely. Discovering drug is primary, market survey once the drug is launched becomes a secondary research. So yes, these were again, absolutely very good examples that we were looking at from a point of view of, okay, yes, I do see something coming up from COVID itself. Um, Secondary research would be to find out data about Covaxin and Covishield. Absolutely right, Dr. Priya. I think that is also being recently conducted to see how the long-term efficacy, as well as in a larger population of set of people, these two vaccines are looking at. Yes, that would be secondary research. Yes, thank you so much for your comments. It's actually very exciting to see, you all interacting. So yes, again, these were clear examples, and I hope we've been able to give a clear understanding of how primary research and secondary research works. Now another question: where does pharma market research start? Ideally, this question is always asked to me. That as a marketeer and belonging to the pharmaceutical industry, when do you think pharma market research starts? So yes, this is a very, very clear, I hope been put in a very clear example that applications of pharma research, applications of research uh, start with an idea, as well as I don't see an end to research. Now, why do I say this? Yes, made a very strong statement, is when you understand that as simple as sowing a seed, from identifying what kind of seed, what kind of climate, what is the soil type, what are the nutrients required. It's all research that you do once you sow the seeds. The second step is to grow the plant. What all is required, whether the fertilizer needs to be changed, or you need to look at the proportion of, from a drip to a sprinkle to whatever kind of irrigation is required. Once the plant moves forward, the needs keep changing. And as rightly said, that from life up to death, research is very, very, very important to sustain the process of the different cycles. So where do I relate this, and how do I relate this in pharma? Where we can clearly see that when we talk about the previous, the product life cycle, before, during, and after. Research is important, as everyone mentioned, that during this drug discovery, and it's something that the audience is well versed with. From the lead generation to the slicing to the identification, from phase 1 to phase 3 up to, this is what we look at, the phase 4 cycle. Phase 1, your entire drug development cycle has research associated to it at every given step. But each of the research becomes very, very different. Now, when we talk about commercializing this, when we talk about introducing, now, for example, they have introduced a product where the sales are zero. Upfront, you can see that sales have increasing. Here in the introduction phase, you do an epidemiology research, you do market sizing, forecast, upturn curves, as well as positioning of the brand. So now what these things actually mean, you can clearly see that these are understanding what the market needs. It's basically, understanding pharmacokinetics, pharmacodynamics for a product in the sales line. That what the product needs from you and what do you need from the product. So in this case, it is ideally seen that what the market needs from you. So you understand, you do research, you understand what are the probable ways. So to give you a clear example that I will talk in the further slides is where, we get much clarity on this. Once the product is growing, then we get into the growth phase. We talk about market shares, we talk about growth, positioning. So it's as when Aspen had a positioning when it was introduced, it also found various other repositioning in from an entire, analgesic, moving up to an anticoagulant. So when that yes, the applications of the molecule can be extended. That's when this repositioning comes in to entirely grow the molecule again. Then comes the maturity phase. Now, in this maturity phase, to give you certain examples in the industry itself, when we look at molecules like either a paracetamol or molecules like an ibuprofen, have reached the stage of maturity. Now, further augmentation in paracetamol would be something that research would demand. So, life cycle management of the product. So, when we saw, what do you say, the Corti-Orbs technology that had come in with Crocin, that was an example of maturity as well as life cycle management. Further line extension, generic launch, patent expires, as well as analog analysis. And the last stage is decline. So at this stage, you can clearly see that sometimes certain ideas have a pitfall. But what is more important is research at this point of how to repurpose this particular, this particular concept or this particular product into further taking them back to the growth phase from here. So yes, so as I said, research is absolutely very, very important at every given product life cycle stage. So yes, again, what are the applications of pharma research? There are multiple applications, so you can broaden it down into two given buckets. One is from the technical and one is from the management. When we look at various, one to understand the segmentation for better use of the product, brand value proposition, new product launch strategies, customer service measurement programs, market program evaluation, promotion programs effectiveness, ad and messaging testing for key market segments, creative concept testing, HCP messaging strategy, HCP segmentation, and pricing. So all of this will come under, this is not a robust list, but this would particularly be under pharma research. And as I said, from the start and the end of the product is where research plays a very, very important role. So yes, let's talk about one case study where it's a very, very interesting case study to understand how research played an important role and helped in terms of commercial value. We are all aware about the successor of Prozac. Perhaps it's an antidepressant, as we all know. We know that it had competition of marketing from Pfizer, which is Zoloft. So Zoloft and Prozac have been at loggerheads with each other since the inception. Now, more importantly, within this same market, when already you had two people fighting amongst each other, Cymbalta faced competition within its class. So Cymbalta and Wyeth's Effexor worked on two brain chemicals, one which was associated with pain. Now, while Effexor was busy creating various ads, or we could call it as ads which were not really understanding what the customer wants, Eli Lilly was digging up into further research, finding out what are patient insights, and then confirmed on differentiating the importance of pain in symptom mix. So if you could see, they came up with a very simple line: depression hurts. And why did they come up with this? Where you can see that, Stacy Miller from Eli Lilly itself, while people know about the classic symptoms like sadness, loss of joy, fatigue, they are less aware of physical symptoms like changes in weight, trouble sleeping, and pain. It may not be intuitive to think of this as a part of mental. So again, as you've seen, that one competition thought about classic symptoms of how we have to take care. But when they diverged their thought, they also looked at what is the other associated conditions. And when they started with depression hurts as the most powerful direct-to-consumer campaign in the United States, which really gave the brand a very, very good push from a consumer understanding. Not only this, Cymbalta hurts. See, as you can see, depression hurts. Cymbalta can help. They started off a lot of digital campaigns, started a lot of revealing pains. Also, I think you all have seen that there is one of the Coke ad that scans your body and gives you, the particular type of coke that you're looking for. These came up with a symptom body map, a newer in technology. So they used, what they did is through, through imaging techniques, they were able to map to learn about depression as well as the list of symptoms that are associated with it. And accordingly, you could map your symptoms that could create, the understanding from a depression standpoint. Here, if you see that FXR was the one that was the first mover in revealing pain. But when FXR did not understand the patient needs, did not understand patient insights, which fortunately Eli Lilly did, and where you can see that in the early 2010s, Simbata was ranking more than 4 billion a year, which it was not even reaching 1 billion in the earlier times. So that's how clear market research, that's how clear identification makes a very, very important aspect to understand what is the need of the market and how do you develop it beyond the conventional, thus divergently thinking about it beyond just looking at the cause and symptom analysis. Yes. Yes, sorry, I keep coming back to you all, but I really like, your responses. Could someone just put an example or a thought how divergent thinking or how the process of divergent thinking when it comes to ideation, similar to that example that I've given, if someone could share their personal example or anything like that, that would be great. We could discuss about that as well. Before I move on to the more, to the everyone's question of what pharma research would look like in the next few years. Okay, I think it's too early. I asked the question. Okay, I'll keep that question parked maybe at the end of the presentation. So yes, I think we did understand the possibility of what is an idea, what is divergent thinking, how market research is applicable. We did discuss a case of how patient insights and need identification becomes absolutely very important. But what is also, I think, everyone's question is, what will the pharma industry look like in the next few years? So it's very clear that one company called as KPMG, which is which is not a market research, but more in terms of a consultancy-based company that works on a lot of design thinking, ideation process, has a very good way of presenting it. So just remember this: from evolution to revolution is what the pharma outlook would look at. So I'm playing a very, very interesting AV. It's clearly seen that very beautifully presented that where pharma would go in the times to come, what is the need, and how as from the academia background, understanding need of what would actually create commercial value is what they've nicely put up. So I'd like you to have a look at it.
The future of pharma is arriving now. It's time to get on board or risk getting left behind. Now more than ever, it's unfeasible and even dangerous to rely on the projection models of old and the predictions of yesterday. Yet many in the industry have already set forecasts for the next 15 years. At KPMG, we believe that the pharma sector has reached a crucial tipping point, due in no small part to emerging and disruptive trends. As a result, these current revenue forecasts may quite simply be wrong. Fundamental power shifts are occurring across the healthcare value chain. The first is that pharmaceutical companies are no longer dictating market terms. Governments and insurance companies are facing mounting budget pressures and are questioning the traditional assumptions of how patients should be treated. As such, better drugs, better pills, and better medicine are no longer the order of the day. It's patient outcomes that have become the main measure of success. Secondly, advances in technology and new entrants in the sector have created a shift in funding from traditional treatment therapies to prevention, predictive diagnostics, and the development of real cures. Preventing cancer by removing birth defects. predicting whether someone will be diagnosed with diabetes, finding a cure for Alzheimer's, and for heart disease, and of course for the common cold. Imagine what that could mean for the pharma industry, not to mention the people affected, who by and large are living longer and healthier lives. Finally, with the reduced demand for traditional products, price pressure is altering the sector in an unprecedented way, with major players revisiting their portfolio strategy. Many businesses are currently making changes, and we're already seeing a shift in focus to 3 new areas: pharma tech, genetics, and immunotherapy. But shifts in portfolio alone may prove to be incremental rather than fundamental to future success. More will still be required. To set the pharma industry on the right path, companies have to change from the ground up, and we expect 3 archetypes to emerge. The first is an active portfolio company, which buys and sells products and services based on their relative competitive position and rate of sales growth. By definition, this allows for flexibility and agility in a changing marketplace. The second is a virtual value chain orchestrator. Here, the company manages information and platforms rather than products. The idea is to collaborate with trusted partners through a virtual infrastructure in order to support patients potentially even from cradle to grave. And finally, there's the niche specialist. This company focuses on one specific therapeutic area or disease and adopts an end-to-end approach to prevention, treatment, and cure, delivering better patient outcomes throughout and overall. There's no question that change is happening right now. What we need to do is work together in order to prepare for it, adapt to it, and ultimately benefit from it.
So that was, I think, something which is very clear, that clearly put, and KPMG did a wonderful job of identifying the need areas from a technical as well as from the management side. If you could see, there were 3 differences. There was a differentiation between understanding what were the evolving therapies. Second is, from a clear understanding of how is it important that companies would adopt this from a commercial standpoint. So there were certain companies that would have multiple therapies and keep changing therapy based on market needs. The second odd companies would only focus on providing support. And third would be a specialized based company. So that's how, certain ideation points would trigger for us. As being, and particularly the audience I'm speaking, being equipped in the field of research, these trends to understand becomes very, very important when we're looking at certain kind of ideation, certain kind of new solutions that definitely needs to be provided into, a commercial value. So I hope, that video was able to give you an understanding of how patients are evolving, how therapy evolving, and at the same time, what is the actual demand of the market in the current scenario. So yes, after coming down to understanding what are the trends, how are we going ahead with, the basic question would be, how do you devise the right path for research? So it is very, very important to understand where does one's interest lie. Whether, when I particularly look at pharma, whether in the space of life sciences, in the space of pharmaceuticals and biotechnology, medicine products and services, or particularly putting the area into animal health. So it is very, very clear for each of us to understand that, yes, we have a particular problem in the space of pharmaceuticals and biotechnology, and that is where we want to focus on. So clarity of thought from the start, I think, will definitely put us in a space that we want to create a change. So what are the particular steps in market research? So I'll put this down here. Step 1, define the problem. Having a well-defined subject of research will help researchers when they ask questions. These questions should be directed to solve the problem that they have adapted for the particular project. Make sure you ask the questions are written down very clearly and that the respondents understand it. Because when we are doing market research, it's very important first to define the problem set. How do you define the problem set is, as you know, in the previous video, we just seen that there are certain emerging trends in the market. These emerging trends are the ones help us identify the need. Now, for example, if we did know that, the associated, the associated problem for diabetes or the associated problem for hypertension or any kind of chronic illness only happens at the point of diagnosis. So now we realize this to reduce the probability, reduce the severity of the disease. Let's understand how diagnosis in a much earlier stage works with the help of, certain fit devices. That's how the emergence of wearable technology came in. That's how the emergence of heart rate monitors through, mobile phones and everything were accepted. So once they defined the problem, they did also understand what was the further solutions. What is important is research can conduct a small can conduct a test with a small group to know if the questions are going whether asked for are understandable, and they will gain enough insightful results. So here also what happens is sometimes from a point of view of how the commercial angle would adapt an idea that would come in from research is very, very important. So, it's also important from an academia point of view that have some kind of small group meetings where you have people from various fields of that particular field where your research is in, to vet the kind of questions that you want to ask and whether you are moving in the right path. That is where you get a clear idea of whether your research is moving in a particular direction or not. As I said in the first slide itself, an idea is something that has a thought or a process to it which is in a particular direction. In case we are moving in a particular direction with a divergence of ideas, comes absolutely bang on to find a very, very good solution to define the problem. So the first step, as I said, was define the problem. And your ultimate step one success would be that you should answer the question, why are we doing this? That is a very, very important problem. That's a very, very important question that needs to be answered. The second step is to define the sample. Now, to carry out market research, you need a representative samples from where your data can be collected from sampling techniques. A representative sample is a small number of people that reflect as accurately as possible to a larger group. So a small sample which has defined variables or characteristics that you can extrapolate and say that this is applicable to the population itself. So once you've defined your problem, you define the sample, then you carry out the process of data collection. First, a data collection instrument should be developed. So now what are various data collection instruments? For example, you have surveys, you have one-to-one group meetings, you have advisory boards, and at the same time, you have a lot of forums that can help you collect data for your targeted set of audiences. So here I will give you an example. If an organization is looking for a new medical device, I would define the problems, I would define the gap areas in that particular segment. And what I would do is run a research either with the industry professionals or with the manufacturers itself to understand that is this the particular need and is this the idea that can help us define the problem of coming up with a new medical device. So you have to clearly define who your sample is, and your sample should be in line with what your research outcomes are. Your fourth step, as simple as that, you analyze the results. Now you analyze the results again, not from the point of view of providing a solution to your problem, as we saw an example in the coronavirus related research as well. Your analysis has to be broad. Your analysis has to be defining each of the questions, answering those questions, and also finding out the areas around it. So as you know, just coming back to the example of the coronavirus, where we could see that one solution was vaccination. Second solution was finding agents that could help manage the condition. Third is trying to find out agents that will help repurpose the condition. And fourth is how to probably stop the spread. So that's how it is defined. So again, when you diverge in the from idea generation or so, that absolutely becomes very, very important when we are analyzing the results. Last is you make a research report, which is again a structure of what the assumptions are. I think from a personal experience as well, one of the biggest mistakes that when we were looking at research, and when I was looking at my own research, I did present reports in the same order of the questions and did not see the potential of storytelling. Again, as I started off with the first slide, yes, as I started off with the first slide, that storytelling becomes extremely very, very important, and thus your report has to give out a story. So here there are certain tips for creating a project report. Storytelling. Start with your conclusions and give them fundamental instead of accumulating evidence. Then what is your actual outcome of the research? Second is anyone interested in your research should be able to extract something from your report so that it becomes relevant for their work. Third, the order of the questions in your questionnaire should not determine the order of the present. This becomes very, very important. And last is restructure data so you can discover new and more value. So these are, clear tips of how market research, once the research is done, how do you tell the story to your, to the people of why your research was so relevant, what are the outcomes of the research, and how does it apply to them? How does it solve their need? And last, I think that doesn't stop till the research, but make decisions. Thus, moving, I think the first 5 steps would, would be very applicable from a idea generating institute like an academic, like an academic institute. What is also very important is from a commercial side, we need to make the decision and take the steps. So taking decisions, act and implementing it so that we can continue our research to see how we can improve the, improve the need further. So to put this in a summary, first we define the problem and research objective definition. Then we research plan and data collect. The data collection and analysis, and last is the data interpretation and finding reports. So this is a clear 4 steps that we can follow when it comes to market research when we are planning. And I think if this is done methodologically, this is done in a much more trackable manner, it will definitely help us reach the end results. So to just give you an example, this was one of the health authorities when we were, out of the regional agency in France. This is an example to measure the enhanced drug prescription of quality and its efficacy. So the French authorities have recently introduced contracts between hospitals, regional health agencies, and regional health insurance, through which physicians are encouraged to prescribe more generics and biosimilars. So what was the objective of the hospital? Development of generics and biosimilar prescriptions at a hospital level to enhance drug cost containment. What was the action plan in terms of promotion of generics on prescriptions, promotion of biosimilars, as well as increasing the level of generics and biosimilars in the hospital purchases? Now, what were the KPIs? So particularly if you could see what were the key performance indicators. That's what KPI stands for, key performance indicators. So percentage of generic prescriptions in the reference list of the hospitals that is retailed to that has been delivered to your retail pharmacies, keeping a national target of 45%. So here the research was that if I reach 45%, okay, if I reach 45%, that will be able, help me success and reach the objective that I was looking at. Percentage of hospitals with biosimilar prescriptions in the reference list is 70%. So these were my targeted hospitals that I would go to based on understanding from research. Percentage of hospitals, generics and biosimilar purchases in the form of units. So all these things came together to define what my overall objective is, which is clearly mentioned on the basis of certain stats that we are looking at. So this was an example of how a market research can be devised with a clear objective, action plan, and KPIs. Yes. Now this would be understanding that we have already understood the process of market research, but how do you constructively ideate? Now this was a very a question put up to me also, and in the recent times I feel design thinking is the most apt method of constructively ideating. And why do I say this? Is because design thinking is an iterative process in which we seek to understand the user, challenge assumptions, and redefine problems in an attempt to identify alternate strategies and solutions that might not be instantly apparent with all our levels of understanding. So currently when we think, we only think of a problem and a solution. In design thinking, we empathize, we define, we ideate, we prototype, and we test. That is the process of completely constructively ideating. And this is, design thinking may not be only applicable to a particular, it can be applicable in any field, any form, or any given idea that we are thinking. Again, to understand design thinking as a concept, I have a very, a very good video that will help us understand creatively what actually the design thinking process is. And after that, I would like everyone to closely understand the video, because the next slide we would be doing a small exercise on design thinking itself right here, right now. Okay.
When companies set strategy, they often stumble. Either they collect a lot of backward-looking data, which doesn't tell them what future customers really want, or they make risky bets based on instinct instead of evidence. Design thinking is a strategy-making process that avoids these mistakes by applying tools from the world of design and shifting the focus to human behavior. Popularized by David M. Kelly and Tim Brown of IDEO and Roger Martin of the Rotman School, design thinking has 3 major stages. First, invent a future. Form a few theories about what customers might want but don't have by immersing yourself in their lives. Instead of polling them about specific products or services, observe and ask questions about their behavior. Next, test your ideas out. Use iterative prototyping with good enough products or services and conduct a few quick experiments to see how consumers respond. Adjust the product, the pricing, or the positioning accordingly. Finally, bring the new product or service to life. When you've got a winner, identify the activities, capabilities, and resources your company will need to actually produce, distribute, and sell it. For example, when senior managers at Procter & Gamble wanted to turn around the skincare brand Oil of Olay, they began by observing shoppers in both mass retail channels and high-end department stores. They realized that their industry had been primarily targeting women over 50 who were worried about wrinkles, while pretty much ignoring those in their 30s and 40s who were concerned about other issues. This was a huge market to be captured. So P&G experimented with new formulations that would tackle multiple skincare goals, then tested different prototypes, price points, and store displays. Finally, the company launched a series of new premium yet broadly distributed products that were well received by a wide range of consumers. By using imaginative, human-centered problem solving, design thinking can help you unlock new markets and identify new strategies.
Yes. So, that was a clear example of how thinking or design thinking helps us creatively ideate, not from a basic problem to a solution, but from understanding how do you improve, it for the for the human mind itself. Because at the end of the day, all solutions are being provided to the humans itself. So if you can see here that design thinking has a four-pronged approach to problem solving. Once you empathize. Second, you have multidisciplinary thinking. You think from all given aspects. Rapid iterative solution deployment. So you have multiple solutions that are available, and you choose the best one there, and you continually improve it. So yes, I was also thinking of it's the basic concept that it's put in a structure. But what I was thinking of, what could be the possible given scenario where design thinking could apply. So to look at the most recent, most fresh topic that we have as of now. So this is a question to all the participants. If we approached COVID-19 as a design problem, okay, keeping in mind these 4 points, could we find innovative ways to apply design thinking and human-centered design principles to help soothe everyday and mitigate the most pressing issues? So I will read the question again. If we approached COVID-19 as a design problem, could we find innovative ways to apply design thinking and human-centered design principles to help soothe everyday's frustration and mitigate the most pressing issues? So again, I open up, I give, around 2 to 3 minutes. The participants can pick up one part of COVID-19, which means, I give an example, we either pick up the vaccination drive, you either pick up the sanitization drive, you either pick up, the awareness drive. From that angle, is there something innovative that we can think about? From empathizing with the humans, thinking from a multidisciplinary point, rapidly finding some solution. So is that we could think of some innovative ways that have not been done as of now. So again, I'll leave this for around 2 or 3 minutes, and then I will come to the chat box to take a few responses. So you can take your time, think about it from an empathy point of view. How would you currently think or approach this from a human aspect? As I said, you can select any of it: the vaccination drive, awareness drive, sanitization drive. You can think of it from a multidisciplinary thinking aspect, not only involving one, but involving multiple other departments as well, and rapidly giving a solution. So one design thinking process that was one was double mask to prevent the spread. So would there be another better solution? Would there be another innovative ways other than social distancing? So that is, I'm just leaving it to you all. Can think about it, and maybe it's 10:48 now. By 10:50, I know time is short, but by 10:50 or so, you could put up certain queries, your responses in the chat box, or you can unmute and speak as well. I think that would be good. Yes, please feel free to put up your messages in chat, in unmute and speak also. I think, yes, so Dr. Priya says, design thinking would help identify the psychological aspect of human behavior firstly. Yes, Doc, you're absolutely right. But what I was looking for is one particular condition, for example.
Sir?
Hello.
Yeah, sir, good morning. This is Dr. Priya Sengupta.
Oh, hi, ma'am. Good morning. Thank you so much for your participation. I'm really excited to see a lot of comments coming from your end. Really nice. Thank you so much.
Thank you, sir. Sir, actually, my point out here was your question was about empathy. So when generally in research, what happens is, as you rightly said, that companies start innovating, and they don't go for pilot study. So then ultimately, when you are actually implementing it, you are actually using push strategy, and you're pushing your strategy on the consumer. So that backfires. So I thought that during this COVID scenario, if you see, firstly, the fear was a factor due to which people panicked, and they were like guinea pigs. They were like guinea pigs, like the government and the hospital and many medical facilities were, like a practical on these human beings, like
Correct.
so I think that when you talk about empathy and when you talk about multidisciplinary, so you should talk about mental health also, and you should talk about the fear due to which actually death is because of fear, because
Yes.
we were not thinking more about the precautions to be taken, but we were even a normal flu would create that fear in our mind that now we are going to die. So
Yes.
maybe I don't know whether I'm on the right path or not. So maybe design thinking would encourage organizations to even address psychological aspect and the psychological behavioral change with respect to COVID. So
Yes.
if I'm right, I don't know. I'm not sure.
So I think, ma'am, you're way ahead of time already. So to just give you an insight from the industry itself, with COVID coming, I think everyone, as you rightly said, was focused on more the symptomatic change in terms of how to manage the disease altogether. Nobody looked at the long-term implication. But I think in the current scenario, companies are now developing a lot of strategies in terms of patient counseling, family counseling of the patients who are suffering from, from COVID itself. So I think, ma'am, you are that really put a very good thought to that, and that is, in line with what the market demands also right now.
Thank you, sir.
Yeah, thank you so much, ma'am. Yes, got a few questions. Yes, everywhere sanitization of hand is required. Yes, we could create a mechanism or a solution where we could bring that up. Design thinking can very rapidly diagnose tests. Yes, absolutely right, Dr. Suresh. I think the need was to empathize with people waiting in long lines for the diagnostic tests, and where the rapid diagnostic tests are now coming. Design thinking helps in solving problems of the unknown. Absolutely, yes. For sanitization purpose, we can turn firefighting systems equipped with sanitizers, and before starting of work can be sprayed. I've never thought of this, but yeah, it's a really good one, Dr. Rana. I think I really like that one. That you empathized with human understanding, utilize the current resources, and something that can be utilized well. Yes, it would be necessary to inculcate some important sanitization cleanliness habits from early childhood, and some basic health education compulsory. Absolutely right. I think yes, Mr. Manish. This is again targeting them at the start so that we can prevent any kind of other pandemic coming up in these scenarios. That's good. Inclination towards a healthy diet plans. Yes, again, that also can be put as a part of design thinking from understanding the your empathy of the human being and then going. Yes, yes, Mr. Gulam. I think important to train healthcare workers again from a design thinking point of view. The idea fits well, but further empathizing with them, creating multidisciplinary points, as Dr. Priya also very categorically mentioned. I really like the structure of way Doc mentioned. That was also well. Yes. So I think we've got a good few examples of how we could take things forward. And thank you so much, for helping me also understand with such new ideas coming in and innovative for driving eating patterns. Yes. Yes, the yes, the polymer. You can see that there. Yes, I hope I know the exercise was short. I just gave you all around 2 or 3 minutes, but I'm sure that all the participants here would definitely look at you know um, further getting into how these 4 points are very important when it comes to creative ideation. So yes, to summarize, ideation is the mother of all invention. The point is, why does every business need market research? Market research is one of the most effective ways to gain insights on customer base, competitors, and the overall market. The goal of conducting market research is to equip your company or equip the organization with the information that you need to make more informed decisions. There are certain decisions may not be informed, may not translate, and thus every ideation is a need of divergent thinking, as we started it off with. So in 3 simple phrases, you define your vision, you ideate the divergence, and you follow the process, which will definitely help us build very, very strong ideas that will turn into commercial value benefiting the industry. So yes, just wanted to put up this quote that simple can be harder than complex. You have to work hard to get your thinking clean, to make it simple. It's worth it in the end, because once you get there, you can move mountains. So Steve Jobs, rightly said, made everything so simple, but to reach to that simple process, you have to make your thinking complex. To make your thinking complex, follow the principles of divergent thinking that will constructively help you ideate in your market research and help you create your ideas into further concepts, and that will further differentiate into a more commercial standpoint, which will benefit all in the industry. So this was all from my end. Thank you very much for being very interactive and at the same time very idea generating idea generating audience. So I think yes, I am right on time. So I can open up the questions. You can open up the round for question and answers. I hope I was able to create justice to the topic and bring in some insights, some relevant insights from the industry. So yes, you can open it up for questions and answers now.
Thank you, Gavin. That was really, really insightful. I've thoroughly enjoyed your talk. So there are a couple of questions in the chat box. So I'll just read them out for you. So
Yeah, sure.
Jyotsna wants to know that how phase 4 market research in India is done in India and its impact.
Yes. So the phase 4 market research. I'll just give you a little context to this. When one of the products was being launched in the oral anti-diabetic segment, it was the first time in India molecule. So the initial promotion had happened through the entire, definitely whatever research was already there. But what was more important, as you said, the phase 4 research. When we look at phase 4 research in India, it happens via the clinical trial route itself, where a set number of population is defined based on the requirement of that particular therapy. So again, if I say that I'm looking at around 10,000 patients, that 10,000 patients are defined keeping a benchmark of the other phase 4 that are done within the same molecule. And after that, there are enrollments of centers. These enrollments of centers, happen based on certain fixed parameters that we're looking from a phase 4 point of view. So again, phase 4 becomes for us long term to a larger population. And in India particularly, you tie up with a clinical research organization. This clinical research organization helps you set up your entire protocol, set up your entire defining parameters of what you have to capture. And at the same time, you also get an idea of who would be the targeted set of centers. Those set of centers have to be well equipped with whatever is your necessities. For example, if we are working in the space of cardiology, we should ensure that the basic instruments or the basic equipments are all available. And once this phase 4 is initiated, we have interim analysis that comes out. Again, this interim analysis is further taken up. Then you look at the progress, and then it's further disseminated back to the medical fraternity to show the efficacy as well as the safety results are very applicable, and it's showing you good results also that we see. So in the last few months, you've seen that in the news itself, there has been a lot of safety efficacy data in terms of phase 4 coming out for a lot of COVID related products. So this is how the process is followed with the help of a clinical research organization. I hope I was able to answer that.
Thanks, Gavin. So our coordinator Harita wants to know how can academic research and studies be outlined in order to meet the market needs, and how can the needs of the market be identified?
Yes. Okay. That's a very, very valid question. So when we look at from the industry itself, we have a need assessment activity that is done. So need assessment activity is basically to understand what has been the emerging trends and where is the probable customer need moving. Now from a from an academic point of view, I understand that resources become limited. Your exposure to the industry becomes limited. What we would suggest is there are a lot of market research agencies that work with industries to partner to understand what is the new need of the market. So first thing is your secondary research that could be done on websites. As I've clearly shown you the video from KPMG to understand where the market is moving in a 2023. So a lot of good organizations like McKinsey, KPMG, BCG, they are all consultants. So if you read their articles, which are very easily available online, you will get an idea on the emerging trends of pharma, emerging trends of healthcare. If currently also you read, there is a lot progressing in the field of artificial intelligence in pharma technology. So from there, you get an idea of what is the emerging trend. Second, what is important is, as I said, try and validate it with an industrial source. So get in touch with someone who is in that relevant field. Have a meeting, understand, present your idea, or present the thought process. Get some validation from there. What happens there is that strengthens and that creates a more core idea for you, which you can take forward. So one is to put it how it will be in line. First, do your secondary research based on as simple as googling what are the pharma trends in 2030, and you will get multiple data points which you can read through. Second is validated from an industrial source, and the third is follow up on that relevant content. So once you are there, have a testing which is done as basic as with a few number of people, see if the concept is working well, and then you can upscale it. So as Dr. Priya also rightly mentioned when we were conversing, that the pilot is actually very crucial to decide whether you scale it up or no. So these would be the 4 points of how we be aligned to the industry, as well as how we could look at certain points from the newer developing technologies.
Thank you, Gavin. So now Dr. Priya herself wants to know, in a pharma industry, is pricing strategy based on production cost, the competitors analysis, or the penetration strategy?
Yes. Priya, that's a very valid question. So I would like to answer this in with giving an example. When we look at insulin as a therapy, again, insulin as a therapy, there are no multiple competition. There is a market which is dominated by certain players. So the pricing strategy there would again be on the patient centricity, on how affordable it is for the patient, keeping in mind the given profits. When we look at areas which are very competitive, extremely competitive. For example, if I look at a metformin market or a glimepiride market, those markets are extremely competitive. And those markets, it all depends on your pricing strategy from competition. If you are a new player, you want to enter. If someone is priced at 10 rupees a tablet, you want to take up their market share, and you know that you do not have any difference in terms of formulation, nothing in terms of generic. You will move on to a pricing strategy from which is lower than that molecule or which is lower than that brand to take up their market share. The third question is penetration. So if you look at Mankind as an organization, has very good penetration across India, and their medicines are well as when we look at from a more penetration point of view in rural areas. So again, that becomes a geographical penetration strategy. Again, pricing will depend on that. So all in all, I think production cost and this gives you the base of your price altogether. But whatever is above and beyond, I think that is very much applicable on where your product lies in which particular market. As I've given you insulin, one open market as well as geography. So it all depends on that.
Thank you, Gavin. Dr. Rana wants to know, suppose I have a compound having good antimicrobial and anti-diabetic activity. So how can I find out that it is feasible for industry purpose or not?
Yes. Dr. Rana, again, a very valid question. When we look at, I think if I'm understanding this well, uh, from from yeah, from an assessment point of view, whether the molecule will work or no. What is important is to understand what are the current molecules working. So if I give you an example again, if I take an anti-diabetic activity, as simple as metformin. Metformin holds a gold standard in the therapy as compared to all the guidelines as well. But with newer molecules coming in, for example, an SGLT2 inhibitor. Now, how did SGLT2 inhibitor come in? Because it benchmarked itself as a molecule which has good efficacy, which has good safety profile, and at the same time, it has benefits of preventing any microvascular complications. So when that molecule gave an edge to the previous molecule is when it realizes that from an industrial perspective, this becomes very valid. So your question is also how to understand the feasibility of this. What is important is to understand the assessment of the current molecules, how those molecules are growing, a feedback mechanism of a primary research, either with the industry or a self independent research done in the academia itself, which means students getting in touch with pharma professionals and trying to understand this. When we look at this, followed by what are the given needs. So if your newer molecule or a compound satisfies those needs, then the feasibility comes in. As an academic institute, I believe, when I was a student, I used to love being a part of these researches and giving a project to a student, able to get a level of understanding for you as well. And second is the data that comes in helps you validate whether this molecule will work on. So this is how, basic from the tech transfer could be done, just to understand from a feasibility point of view whether we can go ahead with that particular molecule or not.
Thank you, Gavin. So, Dr. Harita wants to know at the market research level, how can one ensure the success of an idea?
Yeah, I may not have a direct answer to that, but it's a very tricky question actually. I think my last three lines were there that create your vision, ideate the divergence, and follow the process. What is very important is when people deviate from the process because they don't see success coming at an early stage. It requires a lot of patience, and I don't have to address this crowd in terms of patience. I do understand that research is your core domain, but from a market research point of view, we need to ideate well, and we need to be a little more open-minded. So divergence thinking comes in there well there. Second is after this is done, get a validation on those ideas from someone who's already there, from a conceptual point of view. Third is running a pilot. Fourth is following the process of continual improvement. And the fifth is ensuring that whatever market research is done, you have an implementation done either at a small scale or a large scale. So I'll give you a basic example. There was this mango chocolate that used to come in called as Pulse, which was something that people never looked at from a point of view that it would be a big product altogether. But Pulse was an innovative concept. It was a candy, and inside you had a filling of that mango flavor. What Pulse did is, Pulse did a market research first. It took 2 years to develop that product, understood the tastes and needs of people. And Pulse targeted distribution channels to be the chai stalls, to be the small stores. Why? Is because they realized that people after eating will always want to have something chatpata. That came in from the entire soda concept. So then when they started building slowly, that's when it picked up and become such a big brand today. So the main, understanding from Pulse also is that you ideate well, validate it. Take a lot of time to validate it. once you are very clear that this is what it's purpose for, I think the rest process becomes much simple and you definitely see success. Yes.
Thank you very much, Gavin. I think we do not have any more questions. Thank you once again. It was very, very insightful session. I hope all the participants thoroughly enjoyed it. And now I'd request Dr. Harita to just take over.
Thank you, sir. Now I call upon Professor Ujjwala Shinde, ma'am, our coordinator of the FDP, to felicitate our speaker of session 4. Ma'am.
Thank you, Dr. Harita, and thank you, Gavin. Thank you very much for such a live, engaging session. The topic of market research was timely, and you really presented in a way that everyone could understand. Thank you very much for such a wonderful session. As a remembrance of your contribution to our FDP, our research scholars and our security staff, they have planted a sapling of Ratrani on behalf of you in our lush green college campus. Isha, could you play the video?
Just a second, sir. It is Kenya.
Yeah, and as a fond memory of your association with our FDP, we would like to virtually felicitate you with this e-certificate. Please accept.
Thank you so much, ma'am. Thank you. Thank you.
Thank you very much, Gavin.
Thank you so much, ma'am. I think it's been a complete pleasure of being a part of such a program. It gives me a lot of, what do you say? I'm out of words. Actually, I don't know what to say. But thank you so much, ma'am, for giving an opportunity to the entire managing staff, Sarah, ma'am, for giving me this opportunity to enlighten, such high learned people. So this I will remember it for the rest of my life, and I hope I was able to do justice. And it really gives me this. No, ma'am. Thank you so much. Thank you, everyone. Thank you so much. I hope you'll had a wonderful session, and please be safe. Times are still a little crucial, so all the very best, and be safe and take care.
Call upon all the participants, the speaker and the chairperson, Dr. Elvis. I thank the chairperson and I call upon all to have a group photo for the FDP. I request all to switch on their videos. Thank you all. Thank you, sir. Thank you, ma'am. Thank you, Dr. Elvis.